Hey, y'all, welcome back to the Yes We Can podcast. Today, I have an incredible human on with me today, someone I met through Siteman, the Cancer Center here in St. Louis. This is Dr. Roheena Panni, who studies and is a surgeon and studies pancreatic cancer, does research, and is a surgeon. So we are so grateful and thankful to have you on the show today.
Thank you, Kara, for having me.
Of course, welcome. And we, just so viewers know, we connected, we originally connected when we were on Fox 2 together, correct?
Yeah,
Talking
that's
about,
correct. And we also met at our pancreas cancer patient survivorship series last
that's right.
year.
Yes. Yeah, and we connected. I don't know, there's something about you. I'm like, I want to be friends with this gal. So I'm so grateful you're coming on today to talk about some really important things. But first, can you give us a little background about who you are, where you're from, where you studied, and maybe how you got into oncology and to where you are in your career today?
Absolutely. Um, and I love talking about it, just so you know, because for me, it was a transition to do surgical oncology. So I'm Roheena Panni. I'm currently in my second year as faculty at Washington University in St. Louis. My journey in medicine began when I was in med school at Aga Khan University in Pakistan. I completed med school there, and at that point, I wanted to do cardiothoracic surgery. But then I came for my sub-internships to the US and worked with a surgeon scientist who worked in pancreas cancer immunology, David Linehan. And I saw him talk to patients and give hope. In the clinic, when you talk about surgeries and treatment options, he would always talk about clinical trials. And that part was just so exciting and felt so rewarding. I ended up spending 2 years doing basic science research with him after that. And that was the time when I kind of decided formally that surgical oncology is what I want to do. And I also want to have a career as a surgeon scientist. And thankfully, then during my residency, I ended up spending 2 more years, work with an awesome scientist, David DiNardo, who's a tumor immunologist, worked on developing some immunotherapeutic agents in pancreatic cancer. One of the drugs successfully was launched in a clinical trial, which was again extremely rewarding. I also completed a master's in population health sciences during that time. And I felt that this is like so close to, like so dear to my heart, the research part. That even after completing my fellowship at Memorial Sloan Kettering Cancer Center, after getting my training as surgical oncologist, I chose to came back and work with the awesome team that we have. We have, as you know, a robust pancreas immunology research group at WashU, and which is instrumental as a junior clinician researcher to be in an environment like that. And I'm just so excited to be part of it now.
Yeah, it's amazing. Well, they're lucky to have you because I mean, I just know who you are and what you're doing and kind of how you're trying to change the way that pancreatic cancer is treated. And so what currently are you working on? Can you talk about that? Like what sort of is your focus right now in your research?
So currently, I see patients with pancreatic cancer and other hepatobiliary malignancies, and the focus of my research is kind of lines up simultaneously with my clinical interest, which is pancreatic cancer immunotherapeutics development. It's a long word, but basically, what I'm trying to do is developing new ways to target this tumor. And from my prior experience when I was working on immune modulating agents to improve, so pancreas cancer, the way to if you look at it under the microscope, half of the cells, best case scenario, are tumor cells, but majority of the cells are not tumor. Those are patients' own immune cells. They just happen to be there and they learn to promote the tumor. So my interest has always been to reprogram or activate those cells so because they forgot now they're promoting tumor, they have to be killing the tumor cells. So therapies along those lines to invigorate patient's own immune system to kind of target the tumor cells. And what I'm specifically focusing on is personalized pancreas cancer vaccines, which is a unique therapy. It targets patients' own genetic makeup, and you end up vaccinating the patients against specific mutations that are expressed by their tumor, and every patient's tumor profiling is completely different. And then the vaccines are used to train the immune system so they can recognize and destroy cancer cells instead of the immune system helping the cancer cells. So that kind of therapy is a unique way of doing that. And currently we have clinical trials ongoing where we are studying this approach.
Yes. So, okay, I'm trying to think here. So, because Kyle was not eligible, we did not look down the vaccine route when he, I mean, it was never even really mentioned. So that, that was 3 years ago. So tell me a little bit more, like, what type of patient is able to get a vaccine? At what stage are they getting a vaccine? And what are those where in the clinical trial, what phase are we in the clinical trials? Like, how many patients is it in, and what are the results looking like at this point?
Yeah, so it's an area that has honestly been under development for more than 10 years now, and at WashU for at least 7 years. But you're right, we have a very select patient population that is eligible for it because it's very limited subgroup of patients, those who are considered to be resectable candidates, like patients who undergo a curative resection, are the ones who were getting the vaccine. And that was up until 2021 or maybe 2022. So I think when Kyle was getting the therapy, this wasn't even an option for patients in the
Right.
metastatic setting. But one area that we have, so the idea is that it's supposed to help when the tumor burden is not metastatic, it's not like widely spread.
Okay.
So the trials are entirely focused on patients who have tumors that will be surgically removed. Either they get vaccines prior to their surgery or vaccines after the surgery. But with the results we are seeing, I mean, there is clearly room to spread it across several different clinical scenarios. And hopefully, once we have some more promising results, that would be the future.
Awesome. All right, is this mechanism of action, is this happening in other type of cancers and showing success, or okay, and if so, which cancers, and where is that?
So, yeah, so triple negative breast cancer is an area WashU has extensively studied. Glioblastoma is another area. Now, all the tumors that I'm saying are the ones where you just say the name and we know those are bad tumors. Um, and lung cancer is another area where currently there are trials that are ongoing. There are other institutes that are studying this in pancreas and other solid tumors. So, not widely spread and not out of the clinical trials yet, but there are several promising trials which have shown that patients can, their immune system can be trained and they can generate a response when you use that kind of targeted approach to stimulate the immune system.
Hmm. Do these patients have to have a specific mutation, or is this any type? Like Kyle's was the bad luck type, let's say. He didn't have BRCA or any of those other common mutations. So is this any
Mhm.
of them, or do they have to have certain mutations?
Yeah, that's a good question. So the reason why it's important to remember, these are neoantigens that are expressed by the tumor. So most patients don't express a lot of neoantigens, which is why the tumor types like glioblastoma, pancreatic cancer, those are not recognized by the immune system. But all of them express some neoantigens, which we don't sequence because every patient's neoantigens are going to be different. So this is an approach where every patient ends up, we identify 15 to 20 or sometimes up to 50 neoantigens depending on the tumor type. But those are not the neoantigens I will see in another patient, other than the common ones like KRAS. So you will only see specific mutations that are expressed by patient's own immune system. And by biopsying, we have seen that we are able to recognize enough neoantigens that we can consider, like those are good enough for us to use to develop our vaccine because it's a multi-step process. But I mean, here every now and then we see patients where tumors are so resistant to therapy and so aggressive that they have no neoantigens. And even if the patient is a candidate for those trials, we end up not offering them vaccines because the neoantigen burden is just not enough. But that's like rare because most of the times we end up finding enough to make a vaccine against that tumor.
Wow. It's We've talked long and hard about this, and my listeners know, this cancer research it's a really, it's near and dear to my heart. It's a really hot topic in my mind in our life because there's not enough being done. So, it's amazing that this research is happening, and you and I again talk about what we need really is as much funding as we possibly can to move these treatments along. Um, the government's the number one funder of cancer research, and it's just not enough. So I've talked long and hard with Dr. Eberline about this, who is the head of Siteman Cancer Center, about private funding. And, we truly, there's never enough. And there is promising research happening. So those of you that are listening, whether you're here in St. Louis or in another part of this country or another country, like there is really promising research being done. And we are trying to get more funding into these doctors' hands, like Dr. Panni's hands, to try to further this research, because it's important, with cancer on the rise, we have to keep going. We have to keep pushing. Can we talk about this stress? So you've studied and are looking at stress on metastases, correct?
Yeah, and we discussed about this last time we chatted.
Yeah. So can we talk about, and really just to stress? I mean, I myself am working to try to de-stress in a really stressful. Can we talk about your theory and thought behind trying to reduce the stress of cancer patients, and how if you reduce the stress, that surgeries go better, the patient outcomes are better? Can you talk a little bit about that?
Yeah, absolutely. This is an area that's kind of new to me, but extremely interesting because, as you just said, it's a very stressful process, even if it's a resectable tumor. Like a lot of times we're having conversations where we are talking about a curative approach, like we will complete chemotherapy, you will have surgery, and then you'll be considered cured after the end of the completion of treatment. There are very few patients who are eligible who fall into that category. And our goal is to make sure most of the patients go towards curative, but even the process of going through that chemo and surgery and recovery is very, very stressful, not only for patients, but also for family members. So there are several groups who have developed mouse models where stress can accelerate, it can shift the immune system in a way that it doesn't help with the healing process. And this is work from other labs at WashU and nationally. Even switching the circadian rhythm, like day and night, there's the stress of like not sleeping sufficiently or sleeping during the day and not at night. It affects the way chemotherapy works. And those are like findings where we have not studied in patients that well so far because it's just hard to study. And again, you mentioned funding. But in our mouse models, we have seen that stress can accelerate, and it just doesn't help the immune system, even when you get curative resection and your body is expected to heal, even the healing is slowed. So this is like another area where obviously currently limited by funding, but I'm looking at exploring to see how by controlling the stress, can you make chemotherapy more effective or immunotherapy more effective? And we've all obviously seen that these kind of approaches help in the peri-op setting for sure. At WashU, we have a program called surgical prehabilitation, where prior to getting surgeries, patients get a phone call from a nurse and they talk about how to improve their protein intake, their physical activity, focus on things like mindfulness and a lot of other factors. And we have obviously seen changes on the other side after the surgery in terms of number of complications going down, patients recovering faster, feeling better. And I think those are the areas we continue to need to work on. And those are currently the areas where we don't have much funding available. So a lot of those are initiatives from institutional funding and resources that we have in the university.
Yeah, that's it's so interesting. That's something you and I have talked about, because it like excites me knowing that if we can help manage the stress, that the outcomes can be better. So for my husband and I and many other cancer patients, and families, like you said, it's extremely stressful, starting with the diagnosis. And, it's really, you can't even put words to it. Your whole life is completely, you know, turned upside down. So talk about the most stressful thing ever. And so, my husband really he already was kind of wound tight a little bit. Um, and so this type of, diagnosis sent us all for a loop. And, what's interesting too is, when he got diagnosed, they stopped all of anything he was on, they stopped because they were just basically trying to keep him alive. And one of the medications he was on, they pulled, and it caused more anxiety. And we didn't realize this until 3 weeks after he was diagnosed, that they
Mhm.
pulled this certain medication. And thank goodness we did, because then we were able to get him back and try to like lower his anxiety a little bit. But I mean, I look at him and his case, and I just think about how, I just can't help but point to the stress and anxiety, and that, that was maybe why his cancer grew so quickly. I mean, it was incredibly fast growing. And he did have a mixed response, didn't have great, the first round of treatments, he had a mixed response. Second round, it was stable. But I can't help but think, like, if we somehow could get these patients in a more relaxed place, like I'm like thinking of talking to Dr. Eberline, we need to like create like, I know there's like a yoga space, but like a really relaxing meditative space with PEMF mats and red light
Mhm.
treatment and, aromatherapy, like all the soft stuff you don't think about. But like, if we can have the waiting rooms, have that kind of thing, like, I don't know. I mean, it sounds so silly, but when you have a diagnosis like that, or any cancer diagnosis, it's like you just got to throw whatever you can at it.
And I agree
To
with you. I think there are areas you can totally work on. And all these examples you just mentioned, yes, we have not seen that or developed that, but it's doable. And maybe it will make therapies more effective and lower the stress response, and we will see better results. But it's just that we currently haven't done that in clinics. We have done small versions of little bit of things, but when it comes down to funding and arranging, and big decisions come from that place, and I think that is what's currently limiting a lot of those progressions.
It's funding, correct?
Absolutely, absolutely.
Yeah, so that's your number one hindrance. You're doing all this, you're doing surgeries, you're doing research, and you could be doing, you and many other doctors could be doing so much more with more funding, right? We would be advancing these treatments. Um, it's just a hard topic. So if any of you listening want to support this amazing doctor in her research and what she's doing to try to move the needle, not only on pancreatic cancer, but do you only see pancreatic cancer patients?
I see pancreatic cancer, any of HPV cancers, including liver, bile duct, gastric tumors as well. But my research is
Okay,
specifically in pancreatic cancer.
thank goodness. And we need more researchers in pancreatic cancer. Have you in your practice seen younger and younger patients, or
This is
is
like
that?
one area. Yeah, yeah. Like so, I know you can ask any oncologist or surgeon. There has been a shift, almost like a bimodal distribution, where we're seeing this trend of cancers starting at a much younger age, and these are all extremely aggressive tumors. So clearly, there's a shift, and there are lots of explanations for that. And I'm sure stress and lifestyle factors clearly contribute to a lot of these things, but factors like obesity, that affect changes your immune system to make it more susceptible to diseases like these, and several other lifestyle factors kind of directly are linked to this. And we have seen that this is something we globally, the incidence of cancers and shift towards younger age is happening more so in developed countries, where you see like kind of the diet related risk factors, like high fat diet, more stress levels, obesity, and those kind of factors are directly correlating with the increase. But clearly, there's a huge shift in patients like getting diagnosed earlier with more aggressive tumors.
Yeah, it's, it really points to trying to live a healthy lifestyle the best that you can and teach our children that way too, because there's you know, so much we can't control, but it just, you just hate to hear that. And every doctor will tell you that. And every oncologist will tell you, y'all think it's lifestyle. You think it's our stress. You think it's what we're putting in our bodies. And it's just disheartening.
Yeah,
So
this
do
is
you encourage,
another area. Yeah.
go ahead.
No, go ahead, Takira.
Well, I was going to say, do you encourage your patients to change their diet? I mean, when they get cancer, it's like for Kyle, it was basically like, if you'll eat it, anything. But I mean, it was junk. The stuff that was available at the hospitals, the stuff that he was able to stomach was all not good. So, how do you approach your patients with nutrition and stress? Do you talk about these things? Do you address it? Or is it kind of like, we're just trying to get rid of the cancer? That's what I need to focus on.
Yeah, so we bring it up at various stages, and like you said, during chemotherapy, it's just hard to eat anything. So at that
I
point, the
know.
emphasis is for the patients to get calories in
Yes.
whichever way possible. Although we do emphasize that they should stick with high protein shakes, make sure you look at the calorie count on the bottle or look at the protein amount and emphasize it that way. And I use this phrase and tell my patients, treat those shakes like medicine. Don't think that it's your diet. It's not going to taste
Mhm.
well, but it's going to give you the nutrition. And sometimes that is the case even after we do resections and surgeries on patients. Um, so I do encourage patients for like lifestyle modifications. Once they have recovered from cancer, they're healthy, back to eating normal diet. Um, and a lot of them actually go and make those changes, like go to a vegan approach or like a healthy approach, or start carefully looking at things where that can increase the risk of like cancers and other problems. There's some cancers where we know certain things can actually make a difference, but for pancreas cancer, generally, just like you said, healthy lifestyle, eat like high protein content. And by high, I don't mean only protein. It's a mix of like a healthy mix of all types of nutrients that you need, multivitamins, exercise. Obviously, smoking does not help with the cancer progression, recurrence, or development, and just moderation in most of those other activities, and just make sure that you have some time for yourself every day in terms of exercise, conscious about eating what you're eating. And those kind of efforts are any physician, primary care physician, medical oncologist, all of us encourage our patients to think towards those things, because it all goes back to, like Dr. Keon Lim said, and many other people say, you reflect like what you eat and what you are. So I think that is a message for all the patients, even if patients who don't have cancer. Just that is something you have to keep in mind for yourself.
Yeah, absolutely. Well, I find what about drinking? What are your thoughts on alcohol and cancer?
So it has been, yeah, so it has been correlated with some cancers where the incidence is directly correlated with alcohol consumption. I would say everything, like I said, in moderation. Like one, there are systems that quantify alcohol intake, but obviously heavy alcohol use is can damage your liver and can also damage the pancreas to some extent with pancreatitis and other problems. So just be very conscious about how much of what you're consuming.
Yeah. So I found it interesting. We went to dinner with what, two, three, how many other doctors? And we went to Tony's, and none of the doctors, and I don't drink anymore, none of us had any alcohol. I was watching, I'm like, I wonder if any, and only one person at the table. And I'm like, like, is it because we've all seen and know too much or what? Because, it's just so interesting. It's just, I don't know, nutrition and fueling your body. I'm really passionate about it, but it's just, I just found that so interesting because, drinking
Yeah,
is just so
nobody.
regular for a lot of people.
Yeah, nobody ordered that. I mean, a lot of it has to do with doctors who have to work that night or next morning. but
True.
but you're right. I mean, we consciously make those decisions where you have to um, kind of limit and replace it with healthy, like water. Staying hydrated is more important, and like even staying away from too much sugar, and nobody ordered dessert either.
No one ordered dessert, I know. But it's interesting because Dr. Fields and Dr. Lim ordered juice as their drink, which I found interesting. Who knows?
Yeah, that's right, that's right. But I mean, Kira, going back to what you are doing, like yoga, exercises, and consciously blocking the time in the day to promote that kind of lifestyle, I think that is very important. And that's where we need coaching for younger people who just start their jobs and are just overwhelmed with a lot of stress. I think that is an area, and you are doing great work in that area. And I really,
Thank
really
you.
appreciate and encourage my patients to look for those resources because it's hard to do it on your own. And when you are part of a team and you have a coach like you and other people,
Mm.
that is clearly becomes easy to do those things.
Yeah, and finding a community, there's lots of options, and even low cost options. I know, a lot of everything is expensive these days, but there are low cost gyms that have group exercise, that have yoga classes, that have, spin classes or what have you, or finding a walking partner. I always when I take clients on, I mean, and I don't work with cancer patients, but when I take clients on, a lot of times they're like, "Well, will you personal train me?" I'm like, "Well, I need to see what do you enjoy doing? What's something that moving and getting your body blood flowing, like find something you enjoy that you don't need just me to work with you one-on-one." You know what I mean? Like, and that goes for
Mhm.
anybody to find something that they love that they can do on their own, or a gym that they can get to quickly or what have you. Because it is important. I know they always really encouraged Kyle to get up and walk, get out of bed because he didn't feel like getting out of bed ever. He didn't. And they just begged him to walk.
Mhm.
And it was a challenge, really, until he got that treatment that he got, and was immunotherapy. And so his immune system was attacking the cancer, which was amazing. But until he was a few months into that, he was not getting out of bed and walking because he didn't feel like it.
Yeah.
He was sick.
And that is like an excellent example of like areas that are under progress in the labs behind the scenes, not available for majority of the patients. Similarly, vaccines, if you talk about like the cost of one patient completing that therapy, generalizing it in a trial becomes almost impossible, which is
Mhm.
why you need more funding to accelerate the progression. Like Kyle had a great response to that drug, but how can we make it generalizable to most of the patients who should get that agent?
Totally. And that's where I came in and was like, I have to continue to fight in Kyle's name for others because, there are so many. There are so many people that are going through this, and we all have to band together, the doctors, the patient advocates, whoever is willing to stand up to work and continue to shout from the rooftops that there are good things happening. Hope is coming. We do need cancer research funding. So as many mouths and ears we can, get going about it, the more funding we can get and funding that funnels right to the doctors. So I'm a huge
Mhm.
advocate of if you are going to do fundraising, you want to support a doctor or a certain disease, find a doctor or an organization where you can fund them directly. Um, I work with Petal the Cause, and you've received money from Petal the Cause or not yet?
No, I will apply this round for sure.
Okay, awesome. Because that funding goes right into Siteman cancer patients, which is why I work with them. But I encourage anybody who is really passionate about helping move the needle in cancer research to find a physician like Dr. Panni or like Dr. Lim, someone in a disease that you feel passionate about, and research for them. You can start can be done, and together we can move mountains. We can move the needle on this stuff. Um, So yeah, I mean, any other last thoughts, Dr. Panni, about,
Well,
anything you share with our provider or our listeners?
Well, one thing I would emphasize is don't lose hope when you are encountering some tumors and some diseases which you've never heard of. It's stressful, and that is normal. But one thing you can do to yourself and your family is seek physicians, providers, and teams who are comfortable managing those complex diseases. Like talking about these next generation therapies, it's only going to happen at a large cancer center where there's so many patients coming with pancreas cancer or other complicated malignancies. And as we are discussing about these resources and trials, helping with stress, preparing for your surgery, it's important to ask for those resources. We will do our best to mention those things to you and identify those things, but don't hesitate in approaching and asking for questions like stage 4 cancer. Yes, there's still hope, there's still drugs, there's still trials. So don't lose hope, think positive, take good care of yourself, and use us as much as you can.
Okay. I thought it blacked out.
Okay, I don't know.
To find a hospital that specializes in your type of cancer and does research with your type of cancer. For example, we went into the ER, into a hospital that really focuses on heart. Well, we needed to get to Siteman, and so it took us a few days to get our feet on the ground. Being your own advocate, like you said, and whoever you are listening, if and when, find a hospital that specializes in your type of disease state. And there are houses, if you need houses, there's like, I think the Ronald McDonald House or different type of organizations that can house you while you're getting treatment. You just got to ask the questions, to find those resources. So thank you so much for coming on today. We really appreciate your time, your expertise. Appreciate that you've dedicated your life to this, because without people like you, we would be moving backwards, and we need to be moving forward. So do you have any, is there one thing, I always ask all my people this, one piece of advice someone's given you throughout your life that has changed the way you viewed your life and that you want our listeners to think about or hear?
Well, advice. Most of my advice come from my mom and my dad, and I don't know which one this one came from, but they told me to follow your dreams, and whatever makes you happy in the morning, you wake up and you want to do that, pursue that path, even if it's the harder one. But if it makes you happy and it drives you, that is your answer. So, yeah, follow your dreams and do things that actually make you more passionate about your work and everything that you do.
Amazing. Thank you so much. We appreciate your
Thank you
time.
so much,
And
Kara, for having me. It was such a pleasure
yes,
talking to you.
yes, always. And we will be in touch soon, hopefully making some more moves together some way, somehow. So thank you so
Absolutely.
much. Enjoy the rest of your
Thank you.
Tuesday.
You too. Take care.
The Yes and podcast. Like, subscribe, comment, send to your friends, and hang on for next week. We'll be on again a week from today.